Anemia, a nurse's guide to diagnosis. Nurses are detectives of the human body. We search for clues, piece together evidence, and solve medical mysteries. Anemia is one such mystery we often encounter. It's like a puzzle, and lab results are our guide. Understanding these labs is crucial for diagnosing and treating anemia effectively. Anemia isn't a single disease, but a symptom of an underlying condition. It signals that something is interfering with the body's ability to make enough healthy red blood cells. These cells are like tiny delivery trucks, carrying oxygen throughout the body. When they're in short supply, our patients feel tired, weak, and short of breath. They may even look pale. Our job is to figure out why. Decoding the clues key anemia tests. The first clue often comes from a simple blood test called a complete blood count, or CBC. Think of it as a head count of your patient's blood cells. The CBC tells us the number of red blood cells, their size, and how much hemoglobin they contain. Hemoglobin is the protein that gives blood its red color and carries oxygen. Iron studies are another vital tool in our detective kit. Iron is a crucial building block for hemoglobin. These tests measure the amount of iron in the blood and how well the body stores and utilizes it. We look at ferritin, which acts like iron's savings account, and transferrin, the protein that transports iron throughout the body. Red flags. Recognizing abnormal lab results. Now, let's talk about what's considered normal and what sets off alarm bells. In a CBC, low hemoglobin and hematocrit, the percentage of red blood cells in the blood, are red flags for anemia. We also pay close attention to the size and shape of red blood cells. Small, pale cells might indicate iron deficiency, while large, immature cells could point to a vitamin B12 or folate deficiency. When it comes to iron studies, low serum iron, low ferritin, and high transferrin saturation are telltale signs of iron deficiency anemia. Other abnormal results, such as high iron levels or low transferrin, could suggest different types of anemia or other medical conditions. Connecting the dots. Interpreting anemia labs. Interpreting lab results is like putting together a jigsaw puzzle. We consider the patient's medical history, physical exam findings, and of course those all-important lab values. Let's say a patient presents with fatigue, shortness of breath, and pale skin. Their CBC shows low hemoglobin, low hematocrit, and small, pale red blood cells. Additionally, their iron studies reveal low serum iron and ferritin. In this scenario, all signs point to iron deficiency anemia. Remember, every patient is unique, and lab results should always be interpreted in the context of their overall clinical picture. By mastering the art of anemia lab interpretation, you'll be well equipped to provide your patients with the best possible care. Keep those detective hats on, nurses.